What are female sexually transmitted disease and name of the disease and its causes? So, this is a presentation of Grade 5 from Grade 10 Galilei. Now, we will discover about of the sexually transmitted disease of female. Female sexually transmitted disease. Female are susceptible to range of sexually transmitted disease status that can have serious health consequences. These diseases include but are not limited to chlamydia, gonorrhea, syphilis, genital herpes, HPV, and HIV or AIDS. STDs are typically transmitted through sexual contact, including vaginal, anal, and oral sex, engaging in protective sex, having multiple sex partners, and the starting sexual activity at early age are common risk factors for contracting STDs. It is important for women to be aware of the symptoms and causes of this disease, as well as preventive measure and treatment option. So, number 1 disease, human papillomavirus (HPV). Causes by HPV, which is group of more than 200 related virus. It is primarily spread through sexual contact, including vaginal, anal, and oral sex. The virus can be transmitted even if the infected person has no signs or symptoms. In many cases, HPV infection cause no symptoms are resolved on its own. However, in some cases, it can lead to genital warts, cervical cancer, and other cancer affecting the anus, vulva, and penis or throat. It is important to note that HPV infection that don't cause any symptoms are still capable of being spread of others. Vaccines are available to protect against the most common type of HPV that cause infection and cancer. It is important for both males and females to get the HPV vaccine to help prevent the spread of HPV and related cancer. So this example of HPV. Another one. So we call chlamydia, causes and symptoms. Chlamydia is caused by bacterium Chlamydia trachomatis. It is typically transmitted through sexual contact, including vaginal, anal, and oral. Unprotected sexual activity with an infected partner is the most common way the infection is spread. In some cases, it can be also passed from mother to baby during childbirth. Symptoms. Many people with chlamydia do not experience any symptoms, which can make it easy to unknowingly spread infection. However, when symptoms do occur, they can include abnormal vaginal discharge, women, burning sensation during urination, pain or swelling in the testicle, and men, painful intercourse, rectal pain and discharge or bleeding, the infection of the rectum. So this is example of chlamydia. So another one, disease, gonorrhea. Number 1, bacterial infection. Gonorrhea is caused by the bacterium Neisseria gonorrhea, which can infect the reproductive tract, throat, eyes, and anus. It is primarily transmitted through sexual contact. Number 2, symptoms in women. Gonorrhea can cause symptoms such as abnormal vaginal discharge, pain during urination, and pelvic pain. However, some women may not experience any symptoms, making it essential to seek regular testing for early detection and treatment. Number 3, symptoms in men. Men with also gonorrhea may experience symptoms including burning sensation during urination, discharge from the penis, and swollen testicle. Similar to women, some men not display any symptoms, emphasizing importance of regular screening. Number 4, potential complication. If left untreated, gonorrhea can lead severe complication and such pelvic inflammatory disease in women. So this is example of gonorrhea. So another one, trichomoniasis. Caused is by the parasite Trichomonas vaginalis, the parasite that transmits through sexual contact with an infected individual. It can be also transmitted through damp or moist objects, such as towels that have been contact with an infected individual. Symptoms in women. Symptoms of trichomoniasis may include itching, burning, redness, or soreness, and of the genital discomfort with urination and frothy yellow-green vagina, discharge with a strong odor. Some women may experience spotting or bleeding. Symptoms in men. This is not include. In men, trichomoniasis can cause itching or irritation inside the penis, burning after urination or ejaculation, discharge from the penis, and in some cases frequent urination. However, many infected men have no symptoms. So this is example of trichomoniasis. So the next one is genital herpes. Viral scusa, a highly detailed scientific representation of herpes virus under a microscope. The lineage showcases the integrated structure of the virus, allowing viewers to understand the microscopic nature of the infection. Symptoms and illustration depicting the person experience the symptoms of genital herpes with subdued lighting to create a somber and discomforting mood. This image helped to convey the impact of the condition of individual, highlighting the importance of understanding its causes and symptoms. Prevention, an educational visual demonstrating the prevention of herpes transmission with clear lighting and informative design. So this picture is an example of genital herpes. So the next one is syphilis. Bacterial infection is caused by bacterium Trichoderma pallidum. It is mainly transmitted through sexual contact with an infected person, including vaginal, anal, and oral sex. Skin rashes. One of the primary symptoms of syphilis is the development of painless, non-itchy rash on the body. This rash can appear on the palm of the hands, sole of the feet, or other parts of the body. Neurological complication. If left untreated, syphilis can lead to severe neurological complication. This includes symptoms such as headache, difficulty coordinating muscle movement, paralysis, and even dementia. The syphilis is more of skin rashes. So this is example of syphilis. The head, they also in the body. Hepatitis B. Cause and symptoms. Cause of hepatitis B or HBV. Infection through exposure to infection blood, semen, and other body fluids. Unsafe injection or medical transmission from mother to baby. At sexual contact with an infected person, sharing contaminated needles. Symptoms of hepatitis B: yellowing of the skin and eyes, fatigue, abdominal pain, loss of appetite, nausea, and vomiting. An image of the hepatitis B virus under a microscope captured in scientific laboratory setting with brighting lighting. This image should convey the seriousness and focus of scientific research, showcasing professional equipment and expertise. So, this is example of hepatitis B. So, the next one, human immunodeficiency virus, HIV causes and symptoms. Virus transmission spread through unprotected sexual contact, sharing needles or pass from the mother to child during childbirth or breastfeeding. Initial infection, flu-like symptoms, fever, sore throat, swollen lymph nodes, and rash. Progression. If the untreated HIV can be acquired immunodeficiency syndrome or AIDS, causing severe damage to the immune system. Long-term, chronic fatigue, weight loss, night sweat, recurrent infection, and neurological. So this is picture of a sample of HIV disease. So the last one is conclusion and prevention. Prevent the spread of sexually transmitted disease is essential to practice of safe sex. These include consistently and correct using condoms, limiting sexual partners, and getting tested regularly. Additionally, open communication with sexual partner about studies and testing is crucial for maintaining sexual health. Seeking regular medical care and getting vaccinated for diseases such as HPV and hepatitis B can also reduce the risk of contracting STDs. It's important to be aware of the symptoms of different STDs and seek prompt and medical attention. If any symptoms arise, education awareness and communities about STDs prevention can also contribute to reducing the prevalence of this disease. Remember, prevention is key when it comes to this. Stay informed, communicate openly, and prioritize of your sexual health for happy life. So thank you. So this is a presentation of Growth 5. Thank you for watching.